Now moving on to the next bone, we have the humerus. The humerus is the bone of your arm, and the humerus, it has proximal half and it has a distal half. And today I'm going to talk about the proximal half because this is related to the shoulder joint, and the distal half, we're going to talk about it as we proceed in the videos of this playlist, and that we will explain it in the arm. So in the proximal half we have the head. Okay, so here is the head. All right, and in anatomy, any head followed by a constriction, that constriction we call it neck. So this is the head and this is the anatomical neck, anatomically. Okay, the anatomical neck, this is anatomically what we call anatomical neck. Because we have another one, it's what we call the surgical neck, and we're going to talk about the surgical neck as we proceed and why it's important. But why do we call it surgical? Because previously they thought that fracture in this neck needs surgery, but later on they found out it's not important to have surgery, and it can be cured without surgical interventions. So but that's why we call it surgical neck. And there is important nerve running around it and important artery, and we're going to talk about that later. Now, in this proximal end, since this is the head and this is anatomical neck, we have elevations, and these elevations, we call them tubercles. Like we know in anatomy, if we have an elevation on a bone, we call it tubercle or tuberosity. We have a big one, and we have a small one, and we have a groove or sulcus between them. So the great one, we call it greater tubercle or tuberosity, and the small one we call lesser tuberosity, because we are comparing them to each others, and in between them we have a sulcus or groove, and that is what we call intertubercular groove. All right, so we have greater, lesser. And why is that greater? Because we have 3 muscles attached to it. And why this is lesser? Because we have only 1 muscle attached to it. The muscles attached to the greater are the muscles that move the humerus laterally. They are the lateral rotators or external rotators of the shoulder. And the 1 muscle that is attached to the lesser tuberosity is the internal or medial rotator of the shoulder. All right, we're going to talk about them and the muscles. And between them, the intertubercular sulcus. And if you guys try to trace the elevation, you're going to go down all the way. What happens in this intertubercular sulcus is that the long head of biceps, it runs in here. So that's why the long head of biceps, it runs here, because it tries to reach the glenoid, because it's attached to the supraglenoid tubercle, and we're going to talk about it in the arm. So that's why also this depression, the intertubercular sulcus and its continuation, we call it also bicipital groove. Bicipital because it's for the biceps tendon. Now, if you want to trace the greater and lesser tuberosity, you will find lateral lip, still an elevation, continuation of the greater will give you a lateral lip, and continuation of the lesser will give you a medial lip of bicipital groove. So the bicipital groove, which is here, if you trace the greater tuberosity and go down, you will find an elevation. That is the lateral lip of bicipital groove. There is muscle attached here. And if you trace the lesser and you go down, you'll find an elevation. We call it medial lip of bicipital groove. And this is the bicipital groove. And there is muscle attached to this. There is muscle attached to that. And there is also muscle in the floor of the bicipital groove. And we're going to talk about them as we proceed. Now, there are 2 important things in the middle part of the humerus. Laterally, you have the deltoid tuberosity. So this is a delta-like, delta, which means number 4 in Greek. It looks like a triangle. So that deltoid tuberosity is the attachment of deltoid muscle. So the muscle basically comes all the way, and we're going to talk about it later, from the clavicle, from the acromion, from the spine of the scapula back there, and it goes, and it's deltoid because it's triangular in shape, and delta means triangle in Greek, and it goes all the way to the lateral part of the humerus, and it gets attached to a delta-like elevation on the lateral aspect of the humerus, and that is what we call the deltoid tuberosity. So deltoid muscle is basically deltoid in shape, deltoid in origin, because, and also we have the clavicle here, we have the spine of the scapula, and we have the acromial here. So when it comes as origin, it comes in delta fashion, and it also runs in a deltoid shape, and the attachment is basically deltoid kind of tuberosity, and all of them are triangular in shape. All right, so this is about that deltoid tuberosity. The last thing is we have something called the radial groove. In the posterior aspect of the humerus, we have a depression, and that depression is important because what runs here is the radial nerve. So that's why we call it radial tuberosity. Radial groove. Radial groove. All right, so if you try to see it on a real one, you will find a depression in the posterior side of the middle of the shaft of the humerus, and that is what we call the radial groove. All right, so the deltoid tuberosity is laterally, and the radial groove is posteriorly in the humerus. Okay, now how to differentiate the humerus anterior and posterior? Let's leave that when we talk about the distal end of the humerus in the next topics. All right. And this is another picture that shows you guys how the greater tuberosity, as you run down, you will find the lateral lip, and the lesser tuberosity, if you run down, you will find the medial lip, and here you have the bicipital groove, and this is also what we call the intertubercular sulcus. So you want to call it intertubercular sulcus, or you want to call it bicipital groove. And this is how the deltoid tuberosity is basically deltoid in nature. This is how it looks like. All right, and yeah. Now, what are the important clinical notes in the humerus? It's basically, we're going to talk about the brachial plexus in a separate video, but I want you guys to know that the terminal branches of the brachial plexus are what we call musculocutaneous nerve, axillary nerve, median nerve, radial nerve, ulnar nerve. Why we have ulnar nerve? Because it runs on the side of the ulna. Why do we have radial? It runs on the side of the radius. Why we have median? Because it's in between. It's the middle nerve. Why this is axillary? Because it goes and runs in the axillary region. And why do we call this musculocutaneous nerve? Because it starts by piercing muscles, and it's a muscular nerve. It supplies only muscles, and then it finishes as a cutaneous nerve, and we're going to talk about those things in details as we proceed. But these are the terminal branches of the brachial plexus. And now I want to tell you that forget about the musculocutaneous, because this is a muscular nerve. It runs in between the muscles, and then it finishes in the skin. And when we say we have a problem with the bone, which nerve will be affected? It should be a nerve that runs deep next to the bone. Because if I have a fracture and there is a nerve that is cushioned by muscles, this nerve is not going to be affected. And one example of this is the musculocutaneous. So when we have a fracture of the humerus, don't ever think about the musculocutaneous, because this is a nerve that never runs in close relation with the bone. However, the rest of the four nerves we have here, at some point they will run next to the bone. The first one is the axillary. Axillary it has another name, the circumflex nerve, because it runs by wrapping around the surgical neck. So if we have a fractured surgical neck, this is going to affect the axillary nerve. All right, so it's important you guys know that the axillary nerve is going to be affected in fractured surgical neck. Now, if we have a fracture in the middle shaft of the humerus, we will have a problem with the radial nerve. Remember that the radial groove was accommodating the radial nerve. So fracture mid-shaft of a humerus will affect the radial nerve. Now, what about the last two fractures that we can have? We can have a fracture laterally and one medially. The laterally is the supracondylar fracture. If I have a fracture above the condyles, condyle means the articulating smooth surface of a bone. And because this makes the elbow joint, so this smooth part, we call it condyles. So if you have a fracture above the condyles, you are going to affect your median nerve. And if you have a fracture in the medial epicondyle, the ulnar nerve runs here. So fracture in medial epicondyle of humerus will cause ulnar nerve injury. Right, thank you guys for watching and see you in the next